A public opinion survey from the early 1990s shows that over 1/3 of Americans are practicing non-Western modalities regularly and paying for them out of pocket. They're paying for this out of pocket because yoga has not made it to the mainstream medical paper just yet in terms of health insurance companies not providing coverage for things like yoga. There might be multiple reasons for that, and we'll get into some of the reasons later on. Hint, hint, one of the reasons is going to be like, what is yoga? How does a doctor know what type of yoga to prescribe, right? How does that prescription even look like? So that kind of disconnect exists in the healthcare practitioner's mind. This gap, I think, is evident in how the patients are behaving and how the doctors just kind of, not really sure what to say to their patients. Thank you. We'll just wait for this and for the opportunity. Today, I am here to talk about the book that recently came out. The title is Politics and Promise of Yoga, as you mentioned. And I want to kind of start out with why. Like, why is this important? Well, I think when I started writing the book, it was before the pandemic, but I feel like since then, this has become even more important as we're facing a mental health pandemic of sort, right? We know some people who have lost, someone that they know. There's been a lot of job losses, unemployment as a result of that, and kind of a domino effect where people are getting depressed. Yoga is an intervention that comes into play as a solution for many, many different things, right? As healthcare systems face a lot of burden in terms of cost and even personnel shortages, as we experienced during the pandemic, modalities like yoga come into play as a solution for many different things. So more relevant now than ever. I want to delve into the PowerPoint. Okay, so the context. I want to put yoga in context and where it fits into this biomedical system, right? We have these Eastern systems, then we have the Western scientific system. And when I say Eastern, I don't want to leave out all these other indigenous methods that are being practiced in the African continent and Latin America, things like that, right? What we consider medicine. So I'm going to kind of take a step back and paint the picture so we can navigate through this PowerPoint much more easily. Whenever we get sick, whoever we are, like whoever that person is, especially for, I know, Indian people. If, for example, if we get a cold, like a cough and a cold, what do? We go for some desi upai first, right? Whatever the mom and the grandmother says at home, that's what we try to do at home. So that is our first medical intervention. And if that doesn't work, then we go seek out a doctor. Okay, I mean, I'm just kind of stereotyping, but there's some truth to stereotyping as well. So what is medicine to us is very different from what might be medicine to different people. So again, from every ancient culture has their system of medicine, that the way they pursue health and healing. So having said that, what is alternative medicine is what is of interest here, because alternative to whom, right? That is the question. Alternative to whom? So for example, the person doing the desi upais for cough and cold, the alternative would be going to the medical doctor who's trained by a medical school. So I just want to put that in context. So here, there's a rising interest in what is known as complementary and alternative medicine, CAM, and I'll repeat CAM over and over again, so I wanted to put that in there. Integrative medicine, comparative medicine, or traditional and complementary integrative medicine. All of these terms, imagine a Venn diagram, all of them have things in common, basically addressing that there are other systems and other modalities other than just the biomedical system as we know it. And these modalities include Ayurveda, yoga, traditional medical systems such as herbal medicine, nutritional supplements, traditional Chinese medicine, and mind, body, or movement therapies. The focus, of course, of some of these modalities, most of these modalities, was holistic, meaning the treatment is targeted towards healing the whole person, not just the localized or affected area. And we see that this is one of the biggest differences between the Eastern approach and the Western approach. For example, if there's a broken limb, the Western medicine will just focus on healing that limb, right? Physical therapies will be targeted towards that. But in the East, healing is much more for the holistic, the entire body, and not just for that arm or the limb that is hurting. I know that is a very simplified example, but I'm trying to make a point here in what is holistic versus healing a localized area. So again, this is one of the primary differences between Eastern and Western medicine. Another difference is preventative health versus a response, right? Prevention in terms of healthy eating, the discipline aspects that we see. I mean, I'm jumping way ahead, but even Maharishi Patanjali's Ashta Anga path, right? The 8-limbed path. The first two things are yama and niyama, which are disciplines. So kind of preventative health before you even get to treatment aspects. Preventing or delaying the onset of disease becomes really important here. These are some of the differences. I want to go over the World Health Organization's definition of health. This health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So this is really important. I think the definition, I mean, there are many other definitions. I'm just taking the very first one. And I think here, some things have changed over time in terms of how health is perceived. It's a right for every human being, right? And even the WHO kind of recognizes that. And I'll put this here for a reason, and we'll come back to it later on. Patient behavior. So again, understanding CAM, like what is the public doing? And I'm mainly focusing this talk on what research shows in the West. A public opinion survey from the early 1990s shows that over 1/3 of Americans are practicing non-Western modalities regularly and paying for them out of pocket. They're paying for this out of pocket because yoga has not made it to the mainstream medical paper just yet in terms of health insurance companies not providing coverage for things like yoga. There might be multiple reasons for that, and we'll get into some of the reasons later on. Hint, hint, one of the reasons is going to be like, what is yoga? How does a doctor know what type of yoga to prescribe, right? How does that prescription even look like? So that kind of disconnect exists in the healthcare practitioner's mind. This gap, I think, is evident in how the patients are behaving and how the doctors just kind of, not really sure what to say to their patients. Generally, Medicare Part A and Part B do not cover fitness programs, gym memberships, or yoga classes. And I put that in here because yoga classes here are usually grouped with a physical exercise component. They're not seen as holistic. Usually yoga in the US is just very physical oriented, asana oriented, and other aspects are just kind of left behind. On purpose, sometimes not. This is just how yoga has evolved in the West. The highest CAM use in this survey was reported among high education and high income groups. So it's not like, oh, the poor don't have the money to go see a doctor, and that's why they're seeking indigenous care and indigenous therapies, right? It's not like, oh, I have to do the desi dawa because I can't pay out of pocket to see a doctor. So that is not what the survey shows. So people, highly educated people, high income groups are seeking out these alternative modalities. The survey also shows that 72% of the respondents who utilized CAM did not inform their medical doctor about the use. There could be a couple of different reasons for this. Number one, which we can surmise by what we've kind of said before, is that doctors are simply not aware of what CAM entails or what alternative modalities entail, what is good, what is bad, what they should even prescribe or what they should tell their patients. So patients are going off on their own, seeking this out, and they don't care to bother their doctors about it. The other aspect could be that they don't want to be judged by the doctor, because sometimes the doctor will say, oh, well, this is not very scientific in nature. Or the third thing could be that there's just like some sort of embarrassment. But I think there's a reason why this high education, high income group is not informing their doctor about the use of CAM. And this also kind of paints a larger picture that there's an immediate need for healthcare practitioners, even medical students, medical schools to integrate CAM practices, have CAM courses, have continuing medical education programs, things like that, that are based on, yoga and these other modalities. So is public opinion driving public policy? In this case, yes, because multiple surveys, I just quoted one survey from the early 90s, but multiple studies have shown that people want this, right? When the people want it, of course, sometimes the government responds, sometimes the government doesn't respond. In this case, the government in the US did respond. The US government created the Office of Alternative Medicine, now known as the NCAM, or the National Center for Complementary and Alternative Medicine. And now it's the National Center for Complementary and Integrative Health under the larger umbrella of National Institutes of Health. Their main purpose is research and testing of alternative modalities. So a lot of money gets poured into NCAM via NIH, and this is what kind of goes out to researchers and other people trying to test out things such as yoga. And when I say yoga, I of course mean breathing exercises, meditation, asanas, right? Yoga is all encompassing, though we'll see that how all of these different components are being parsed out of it. In recent years, the Affordable Care Act, also known as the Obamacare plan, mentions integrative practices about 8 times. I think that's a typo. It's 80 times when discussing health promotion, prevention, other public health practices. So CAM is definitely on the public and government agenda. Bottom line, CAM and yoga is here to stay. So what are we going to do about it, right? People want it, people are practicing it, government is taking recognition that there's a need for this, money is being poured into it. Now, so what? But what is yoga? Yoga is as ancient as time. Many of us are aware of this, the Indus Valley Seal, where we see Pashupatinath or Shiva, Adiyogi, whatever we want to call him, address him, indicates that yoga was already being practiced in the Indian subcontinent at that time, right? For a seal to exist, we can kind of surmise. I know this is a point of contention, but as a yoga practitioner, I want to say that that is how I interpret it. Of course, Maharishi Patanjali codified the already existing yoga texts and created the Yoga Sutras, right? He did not invent it. He took it from different places and put it in one place. So that means it existed long before him, right? The Eightfold Path is sequential, and this is what I want to harp on a little bit, and starts with the Yama and the Niyamas, which are aspects often overlooked, especially in the West, given the overemphasis on physical postures or perfecting the asana. We'll revisit this as we continue to move on. So what the book is about what yoga is and isn't. It goes into depth, provides context to the reader to discern authentic and classical forms of practice versus what they might see being practiced out today, gym or whatever. The book also starts with the 6 darshanas, right? And this is important because even me, I often get like, is yoga Hindu? Like that is a question that keeps popping up over and over and over again. Well, if we look at the Shat darshanas or the 6 darshanas, imagine that being, a cloth, and we cut out 6 different pieces. If those are the 6 different darshanas, so darshana is a way to see yourself, right? A way to recognize yourself, to be more aware of yourself. Again, I'm simplifying it, but there's 6 different ways to do this, right? Yoga is one of the different ways. Again, I had talked about a Venn diagram earlier. There's no way to kind of parse out that piece of cloth from the others because it comes from the same thing. The essential element of that cloth remains the same as the other 5. So is yoga Hindu or not? Again, this question keeps popping up everywhere we go, and it's generated a lot of debate along with some other questions that we'll get into later. The book talks about human existence, different yugas, the ashramas, the purusharthas, the sharira, right? It's a gross and subtle constituency. Talks about the pranavayus, the tattvas, the indriyas, the relationships between the macro and the micro, right? The larger self and the smaller self. I mean, it's regarding same when it comes to the elements that comprise both the macro and the micro. Talks about the 3 gunas, the 5 koshas. Talks about yoga physiology, right? When we dissect a human being, I'm just kind of saying don't, but if we look at a human being, we're not going to find chakras if we if we dissect, right? Therefore, yoga physiology, where these things fit in, flow of the nadis, transcending the sharira, and of course, the concept of good health and well-being is talked about in the book. Also discusses the different types of yoga. This is another big burning question that comes up, like what type of yoga should I practice? So the book discerns between like Kriya, Hatha, Bhakti, Jnana, Karma, Nada Yoga, Laya Yoga, Kundalini Yoga, Tantra Yoga, etc. I've also kind of gone through the 20 Yoga Upanishads and kind of put in what each of these say about reaching the states of samadhi. So how it works? Well, basically kind of utilizing our prarabdha karma allotted for this lifetime, but yoga helps kind of drop that warehouse of sanchit karma that each of us carries. So just kind of that is in brief. Many different gurus have talked about all of these things much better than me. I've simply provided a literature review, but I did want to address it, that this is in the book because the book is mainly targeted towards those who wish to learn a little bit more about yoga, especially those in the healthcare field. Moving on, yoga, a few decades ago, ill health was caused mainly by communicable diseases, right? People kind of caught things from one another. However, after the Industrial Revolution, there have been challenges and changes to human lifestyle, and people are experiencing a lack of well-being due to non-communicable diseases. So what does that entail? Things like chronic stress, right? Sitting in one place, sedentary lifestyles, lack of physical activity, obesity, bad eating habits, and increased consumption of addictive substances. All of these things have kind of led to lifestyle changes and challenges which people are experiencing today. And as earlier in the talk, as I mentioned, the most popular CAM intervention is yoga, and over 36 million Americans reportedly practice yoga. This is according to a survey that was done in 2016. So the number keeps increasing. I think by 2020, the reported number was 53 million. And I'm pretty sure the number has gone up since the pandemic, as yoga, especially pranayama, has been very beneficial for all types of lung ailments during COVID. Yoga research. I want to get into this a little bit because not too many people are familiar with how well yoga interventions are working. Yoga research has exponentially increased over the past decade, given the amount of grant monies being put in by NIH, etc. Research shows that yoga helps build awareness. It helps with a positive attitude, of course, because it treats more than just the symptoms. Top 5 non-communicable diseases in the US and much around the world are cardiovascular diseases, cancers, chronic respiratory diseases, diabetes, and mental health disorders. So I've kind of, in the book, kind of grouped this as physical ailments versus mental ailments. And these are costly. They place quite a bit of a burden on healthcare systems, which are even more strained now than ever, given COVID. Most clinical trials have focused on major health disorders, both physical and mental, and this includes depression, anxiety, cardiovascular disease, and respiratory conditions. And I mention this because, of course, yoga interventions and studies have been done on other conditions also, but majority of the studies focus on these areas. So as of this morning, my morning, when I just kind of put in research study plus yoga in Google Scholar, it came up with 597,000 results just as of this morning. So almost 600,000 studies have been done on yoga and different aspects of yoga and back pain, yoga and neck pain, yoga and diabetes, yoga and whatever else, right? So this is what we see. So I want to put the number in context. Just some of the things where yoga has been useful. 100 million adults in the US live with diabetes or pre-diabetic conditions. This is the 7th leading cause of death, according to the American Diabetes Association. And of course, yoga intervention has been seen to reduce blood fasting, fasting blood glucose levels, and better maintenance of diabetes to management. Heart disease is another leading cause of death in the US for both men and women, especially of people of ethnic backgrounds. and 23.6 million deaths are projected by 2030, right? Of course, yoga has been tested in this population. Long-term yoga practitioners show effective and sustained results in alleviating symptoms of cardiovascular conditions. And not just that, a mental relief of sort also. So you'll see that even on physical conditions, yoga seems to make people's mental state better. So this has been interesting in many studies which have captured this. Non-randomized control studies also show similar things about yoga in cardiovascular disease. Another thing is hypertension. About 75 million Americans suffer from this. And the American Heart Association, it took them a while, but they've begun to recommend yoga for reducing systolic and diastolic blood pressure. Other studies also show that, hey, with the maintenance and a little bit of change in lifestyle, especially with diet and alcohol intake, yoga can help play a major role in managing hypertension. Another thing is respiratory ailments. They're complex. Risk factors such as pollution, smoking, conditions such as chronic obstructive pulmonary disease. All of these lead to improper airflow disruption. And a handful of studies in this area have shown that pranayama helps with those suffering from things such as shortness of breath, increases breathing capacity, and improves pulmonary function. I'm mentioning these things for a reason, because many of us, again, don't look at studies that are published to realize the benefits of yoga. Again, musculoskeletal and immune conditions affect our locomotion. Things such as rheumatoid arthritis, carpal tunnel syndrome. Yoga therapy has been very effective for alleviating various of these conditions. Similarly, yoga has been seen to show improvement for neurological and immune conditions such as pain, brain injury, Parkinson's disease, Alzheimer's, autism, and stroke. So I personally work with stroke patients for a number of years, and I, of course, can attest to that for whatever that means, right? Not a scientific study by any means, but it definitely improves a person's mental well-being. They just feel a little more positive about life. And even though they're like, yes, I can't move all my limbs, or I'm bound to a wheelchair, you can see that there's definitely some improvement in their overall well-being. Cancer is a big one. 1.8 million new cases of cancer were projected in 2020, and yoga is one of the most popular modalities for those affected. Not only does it alleviate side effects of radiation and chemo, but again, people's mental well-being and coping mechanisms improve with yoga in cancer patients. Now we move a little bit to the anxiety disorders. Things such as stress and depression are on the rise around the world. Patients often turn to non-pharmacological and unconventional therapies such as yoga. And yoga in many different studies has seen to improve symptoms of these disorders. So I'm going to take a little tangent and say that many of these yoga studies, many of the behavioral science studies are seen in school kids and college kids and that type of population. And yes, stress and depression do seem to improve with yoga as an intervention. Again, yoga shows promise in other populations as well, with pregnancy and postpartum health, youth and college students, which is just the population I just mentioned, those suffering from PTSD, right? The prison population, as well as the refugee population. Yoga, of course, is also very important for caregivers, those who are giving care. So, for example, someone with stroke, someone with suffering from cancer. So those caregivers tend to be extremely stressed, and so yoga has been very helpful for this population as well. Same with first responders, meaning fire and police, right? And others who are immersed in a high stress environment. Bottom line, yoga is scientific and evidence-based. It's cost-effective, right? Not very difficult to seek or administer, and it's non-invasive. You don't have to ingest anything to try it out. So what? Like, why does any of this matter? So now we get into the politics section of this a little bit. Yoga is a mind-body practice that has a significant role to play in how public health policies are crafted and implemented in nations and around the world. So one of the big win, of course, was the creation of International Day of Yoga, established in 2014. This was a huge win for India as its soft power finally got recognition, as it should. But to put it in context, I want to say that the World Tai Chi and Qigong Day was established in 1999. So it took India a little bit of time to get to this point, but finally IDY, International Yoga Day, is recognized. And I think this has really helped put yoga on the map as a serious practice around the world. One other interesting thing I want to bring up is a case. It's a legal case, Sedlock versus Baird, where a set of parents, I think parents sued the Ensenadas school district because they did not want their children participating in yoga administered by the district. And this went to court. And the good and the bad thing is the court ruled that yoga is devoid of any religious, mystical, or spiritual trappings. So here, the win for yoga is, yes, you can continue practicing it in schools. School districts can continue administering it. But again, the bad here is that it said American yoga had nothing to do with spirituality or anything religious or anything mystical. So here, a win or not, I take this as an incremental win personally, but we see how yoga has changed over time anyway. So what is seen to be practiced in the West, it does not have anything spiritual in nature most of the time. Main challenges. Some of the main challenges are how to integrate yoga into conventional biomedicine. And before I get into the next point, I don't know if this chart will be visible to folks, but here, mind-body practices according to the NCAM folks, we see, I'll just kind of read out some of the things. Mindful eating, mindfulness and spiritual practices, meditation, breathing and relaxation techniques, movement education, yoga, right? So yoga here does not encompass what Maharishi Patanjali's definition and sequence of yoga is. You see how mindfulness is taken out, spirituality practices are taken out, mindful eating is taken out as something different from what yoga is. So the way yoga is portrayed here is basically asana-based, physical-based. So I want to say that there's no agreed upon definition of yoga, especially in the West, because often breathing and meditation and mindfulness, which we know is dharana dhyana onwards, is kind of taken out as something different or something outside of yoga. Mindfulness, again, is another interesting phenomena because it's been associated with Buddhist practices and not necessarily Hindu practices. So we see that the Buddhist practices, which are secular, like mindfulness, are getting much more traction and are being viewed in a better light than yoga, which of course contains dharana, dhyana, etc. So I want to put that out there. That is the politics of it, one of the aspects of the politics of it. So who is to provide guidance to behavioral researchers? So for example, a set of researchers at a particular university decide to see how college students in a semester, if stress is being reduced, if their grades are improving because of a yoga intervention. Who is to tell these folks what yoga is, what yoga teacher should come and teach, right? Or any of the other standardization points that should be brought up when designing these studies. So that is one thing that is missing. And also, of course, we know not every yoga teacher is the same. Should there be a standardized credentialing worldwide? And of course, what role does India have to play? Like, should we outsource this to the UN? Personally, I don't think so. I mean, that India is the place, right? The Indian subcontinent gave birth to yoga. So I think there's some onus and some leadership aspect that India should take in kind of taking charge of maintaining the narrative. Other cultural challenges, as I mentioned before, is yoga Hindu? Is yoga Hindutva? There have been tons of writing in all types of media where this question is grappled with. Is yoga Indian? That is something we see. Is it, right? And then we'll get to that on the next slide. Is yoga religious? And then recently we've seen like yoga is Brahminical patriarchy because women are not allowed, or women were not allowed to practice it, which anyway, Bhakti yoga is something that was very accessible for women, but that's that. Can non-Hindus practice yoga? And who should be responsible for standardizing yoga credentials and regulating teacher training? So these are the questions, the politics-laden questions as we go forward. The marketplace of yoga. This is one of the last big points I want to make. Classical yoga from thousands of years ago does not look the same as what is practiced in the mainstream today. Why? Because yoga has made its journey from India to the West, right? It was taken by gurus to California. California, it kind of underwent some changes, and that California yoga now is out back to the globe, including what we see in India these days. So yoga has gone around the world, and it is no longer the same as what it used to be thousands of years ago. Does it still work? Yes, but it has changed. So this phenomena has allowed cultural appropriation, and elements have often been borrowed and modified according to demands and needs of the market. And some of the examples include beer yoga, wine yoga, chocolate yoga, American yoga, cat yoga, goat yoga, naked yoga, Christian yoga, right? Overemphasis on the physical aspects is another thing, right? Asanas. And also this kind of becomes completely devoid out of spirituality. However, this is considered to be pragmatic by many. Why? Because this is what the market demands. Legal battles involving patents on poses. Some of the things, terrible things to come out of yoga are people trying to patent poses or sequences. One of our own, Bikram Chaudhary, was involved in something like this, right? So we see a lot of co-opting of traditional systems and then kind of it being sold as something new or something entirely different. I already mentioned Christian yoga. Christian yoga, I've been a witness to some of the sessions. It's like you read a verse from the Bible and then you do a yoga pose. And then you kind of keep repeating that. Very interesting. Practitioners have spent about 16 billion on yoga goods and yoga classes in terms of fees. Mindfulness apps are a booming industry. For example, Headspace, estimated at 250 million, right? So yoga is an industry. It is unstoppable. These are some of the challenges when we try to set the narrative about what classical yoga is. Potential. The potential is endless. And I think the time and the window of opportunity given COVID is now. Holistic medical and spiritual tourism is on the rise. Thailand, India, Vietnam, Thailand. India can take a couple of, borrow a couple of pages from the Thailand book and how to run some of these things. Of course, India is doing a great job in terms of medical tourism. There's industries set up where people, book hotels close by to wherever their hospital is and whatnot. I mean, I don't want to get into this, but India is doing its thing, but India can, of course, do more. And so the potential is here. The time to act is now. So big burning questions. What constitutes yoga in contemporary times? Who sets the standards? And what can you do, right? What can the individual at the micro level do to maintain the correct narrative? And this is what I will end with. These are the references that were cited in the presentation, and I will take your questions.
Namaste, Anjali ji. I just wanted to ask, from my minimal understanding of how the West views yoga, they obviously discount the existence of prana because that's something they can't measure. And they look at breath as a very physical, biological, which breath is, but in our understanding, there is a component of physical to even the breath, let alone from the prana. So when you don't understand the flow of prana, yoga is being practiced out of context. Then you have different postures, even if you're practicing just the asanas, focusing on that. What stage you take the breath in, what stage you exhale, all those become really crucial in the prana flow. So I am just wondering, how is it that it is benefiting them when they have discounted prana as not even existing, not applying them in understanding the yoga movements, how is it benefiting them? Because it must, I've gone to places where they don't even talk about the breath. They're just talking about physical movements. Breath is not even aligned with it. And I wonder if that's causing more damage. And I've seen articles in many Western newspapers and stuff, where they talk about, is yoga actually that helpful? Is yoga also causing damage and we are not talking about it? Those, it's trying to, and I'm thinking, yeah, well, obviously it will cause damage if you leave out sections of it and practice it out of context. What are your views about that?
No, absolutely. And again, I mean, newspapers like to sensationalize things. And yes, I mean, again, yoga is here to stay. So whether these newspaper coverage folks like it or not, it is what it is. But a couple of different things about what you said. Yes, total agreement. If people don't understand what the nuances are, how do you measure it, right? This is one of the biggest methodological challenge, and I cover all the methods challenges in the book. And I wasn't sure how much to bring it in for a 30-minute presentation, but this is one of the biggest challenges. Yes, people typically measure heart rate, cortisol, right, to see how stress is measured. People these days are looking at biomarkers like interleukin. Researchers are taking all of these components. However, how do you measure something that happens on a spiritual plane? How do you measure that change in energy that is not physiological, right? How do you measure that well-being? Well, science has not caught up with yoga yet. So yoga is way ahead. Science has yet to figure out how to measure some of these things. So I will agree with you and give you that, because that is one of the biggest method related challenges in yoga research. Other thing that you mentioned is something that I brought up earlier too, like who is administering this practice, right? Is that person vetted? Was it the same person who administered throughout the study, right? Some of these nuances are just never captured. And even if we're not paying attention to the breath, even if you're just doing poses, of course, there's going to be some value added to the yoga practice. This is also what some studies have shown. Studies show that even if you do bad yoga, it's still better than doing no yoga at all. Even if you just do the physical aspect of things and not pay attention to breath in or out, none of that, you don't sit in silence, it's still going to be beneficial to you. So that is the good part about this. Like, so I want to end all of this, even the presentation at the end, on a hopeful note. Like, even though these are the challenges, yoga is here to stay, and it has survived for thousands of years because it works. So I hope I've kind of answered your question. Some things, there's no solution for it unless we really define what yoga is and isn't, which I think the onus is on the government of India. I know Ayush exists. Ayush probably has their hands full, but there should be more, in my opinion.
Thank you. Yes, you did answer my thing about even if you separate breath, it has benefits. I appreciate that. I just had one comment that came to my mind as you were speaking, is that the West seems to be driving the dominant narrative based on binaries of science versus religion and spiritual versus material. All in our views, like our Indian views, are very false binaries, but that conforms to their biases, and they view it as objective, which it is because it is focusing on the object, but it doesn't mean it's unbiased, which unfortunately objective has started to become synonymous with unbiased, which is not the case at all. So when you're focusing on objective, you're biased and you're removing everything that is beyond objects. But that was something that came to my mind, as those binaries taken as the basic assumptions and assumed to be unbiased is creating a whole plethora of problems. So, well, thank you. I really appreciate your presentation. I look forward to reading your book when I can afford it.
Thank you. I know. And that is another thing. It's an academic book. I mean, this is just how it's priced. I had nothing to do with pricing, like full disclosure. So I think after like 8 months or a year, the paperback comes out and it's much cheaper, just FYI. I want to be very honest about it. I had nothing to do with the pricing.
I actually wanted to talk about the political aspects, especially in America, about yoga. If, the right-wing hardliners form the government, then yoga will be called satanic. And if the leftist liberals make the government, then yoga will be called Christian and it'll be rid of its spiritual aspects, which are even more important. So this is the first time, like how sushi has become the mascot of Japanese culture in America, how K-pop has become the mascot of Korean culture. Yoga is going to become the mascot and has
Better
become the
than
mascot of
Bollywood.
Indian culture. I mean, yes, of course, the Bollywood, but I think with
No, I said better than Bollywood.
absolutely, absolutely, and the dissociation that India has shown with Bollywood, I think only furthers yoga to be its mascot. So, under this, I asked that there is a lot of political support that the Black community has in America, and they have this cultural attachment to their Egyptian roots. And so they're saying that there is this thing called Kemetic yoga that predates Indian yoga. So that is a very problematic narrative that I think will get political support over there, regardless of what the government is. So how do we tackle that?
So that is a really good question. And I want to say not just, so of course, African Americans being the minority, but there are many other indigenous minorities in the US. And I feel like as the US population continues to become more non-religious but spiritual, that's a category that we see in surveys year after year, non-religious but spiritual category. As we see these folks become larger and larger number, there's something they're seeking. They want to go back to the roots. And the roots, of course, invariably are pagan in some sense or another, as we understand it. So while these movements will continue to happen, I am not worried that yoga will not survive because it has all this time. So I'm going to bring that in. But I think there's a lot of movements that kind of want to go back to the original self of who we were also. So there's counter movements as well. Maybe they're not getting traction in the news. But I agree with you. I mean, yoga, it is a battlefield. Either side we look at. And I feel like the narratives coming from India sometimes are even much more harsher than what I see in the papers here. Sometimes what I see here is like, oh, just kind of maybe just plain ignorance, which is fine, because then you can kind of go seek it out in a book. Sometimes what I see coming from India is much more malicious because it's well organized and it's planned. It's not simply ignorant. It's sinister. So I'm in agreement, but at the same time, I want to be hopeful that with a little bit of intervention by the government and lobbying groups, we don't have any of that here. We don't have collective action on the ground here in terms of yoga. If retired doctors and nurses and other health practitioners want to come together and form a lobby group to lobby yoga, I think we could, first of all, kind of get it recognized by insurance companies. And once it's legitimized that way in the system, then all of this just kind of fall by the wayside. I mean, stones will keep getting thrown at yoga, but I don't think we can do something to prevent it.
Anjali ji, I was wondering, in the initial part of your presentation, you mentioned about the Shad Darshanas. That's something you've discussed in your book. So I'm just wondering, did you discuss the Shad Darshanas just as a, like you said, like a cloth with 6 pieces, and within that talking about the Yoga Darshana to give that context, or was it in a different perspective? Because I was wondering where that comes in with the rest of your presentation, where that fits.
Okay, so that comes in by kind of going back to what is the origin of yoga, right? What is the overlap primarily with Samkhya Darshan? Because this becomes important because of the arguments that, oh yes, you yoga does have Ishwar Paranidhana, where you're like, yes, there's a deity, and then there are other schools of thought. We're like, oh no, there's no such thing, and then all we go to is Shunya, which is absolutely nothing. So even talking about the different types of samadhis, like Nirbija, this and that, this comes into play. Why? Because there's a lot of overlap with Samkhya. So it does go into depth, especially about the views of what life is, and of course how death is viewed, and of course what a higher deity, whether that is necessary or not. So I talk about all of that. I just, in a 30-minute presentation, I didn't have time to go into the esoteric, but yes, it's in the book.
Yeah, I guess I was just thinking, as you were saying, it also makes sense because our darshanas are not really compartmentalized and completely different from each other either. They have this that ties them. So it's helpful to have that overview and then see where yoga sits in them, but also to see, like you said, the overlaps and the connections with the others, where one flows from one to the other. So thank you. I really appreciate your book. Thank you so much.
Yes.
I would like to ask you one question regarding yoga's contribution in biomedical sphere. Like we had now COVID recently. I think our Indian government lost a wonderful opportunity to put forward yoga as a solution for this pandemic of corona. Because even now, the allopathy has no solution. I mean, there is no solution for corona even now, despite the vaccinations people do get, and there are very bad side effects, even leading to heart attacks. We've seen that in many mRNA vaccines. So, what is your thoughts about it? It's a lost opportunity. How should India take it forward? Because yoga is not just contorting or giving physical poses. It's much more. It's a holistic system of keep well-being of the mind and the body, and connecting to the Almighty. So, your thoughts on it? Thank you.
My thought, yeah, I think vaccine diplomacy was brilliant, and if we had promoted Ayurveda and yoga along with it, it would have been even more brilliant, right? And to take a little bit of a side note, we're talking about the politics of yoga, but the politics of Ayurveda fares even worse. Ayurveda fares even worse because there's no popular movement around it. It's not on the public agenda. It's not on the government agenda. So yoga fares a little better. So yes, here's an opportunity, right? One good thing is technically the pandemic has not been declared over, so time is still ticking. And if some movement is to be generated to kind of push yoga out as a solution for all of these things, it should. And again, this comes from not just bottom up, but then the government has a role to do this as well. So it's not going to come from individuals on social media tweeting all of this. It has to be somewhat of an effort coming from a ministry. And I think the same ministry should also kind of take over some of the credentialing aspects as a responsibility and not as a burden, and not put things out to the UN or some other agencies to figure out. So yeah, lost opportunity. I hope not. I'm very hopeful that this will happen. Just like the International Day of Yoga was declared like way long after China did its thing and recognized Tai Chi. It just takes India a while. So hopefully some things will happen in that sense.